Family, as promised, I will try by the help of God not to use too much of pharmacological or medical jargon, but I will try to speak in a manner that can be easily understood. So today the topic I wanted to talk about is low iron, which is a common problem for most of females. We know that low iron can cause anemia. Anemia is a condition where your body has low red blood cells. So if your body has low iron level, that means it can't produce enough hemoglobin, it can't produce enough blood cells, and we know blood cells are required by the body to transport oxygen from the lungs to the rest of your tissues. There are many different kinds of anemia. It can be due to vitamin B12 or folic acid deficiency anemia. It can be hemolytic, where maybe your red blood cells, they are destroyed faster than they can be replaced. Some chronic conditions like cancers and HIV, especially the chronic kidney diseases, they can cause anemia, because for someone who has CKD or people who are banking the erythropoietin called EPO, that hormone that stimulates the bone marrow to produce blood cells, it is not produced enough in the body, therefore leading to anemia. So the symptoms of low iron or anemia: you mostly feel tired, you feel dizzy, you feel a headache, shortness of breath, and many more. Especially if you are exercising, or maybe not even exercising, you're working hard at work and then all of a sudden you feel tired. Yes, you're eating well, yes, you are avoiding this, and that could be anemia or low iron. So that is why I encourage you to go and check it. It can be checked in a rapid test can be done in the doctor's room. It can also be done maybe in the sister's room at the clinic, but I do suggest, after doing that rapid HB test, do the full blood count to see what is the problem, because sometimes it can just be iron levels. As I've said, it can be your folic, it can be your B12, it can be your storage. So you have to, storage, your reservoir of your blood cells. So you have to know what is exactly causing the anemia. So the full blood count will give you a definitive answer. So the normal HB level for women is between about 12, ranges about 12 to 15.5 grams per deciliter. Because we lose blood every month, some of us, they are heavy flowers. Pregnancy, there's an increased demand. You have to supply your body and your fetus. Diseases like gastrointestinal disease, for example, ulcers, hernias, and you then correct it. You can take the iron supplements for about 3 to 6 months. Average on 20 days. Take about 3 to 6 months. They are available without a prescription from pharmacies. But when you take iron supplements, I do advise that you take vitamin C. Vitamin C is important for absorption of iron. And also you can add folic acid. As I've said, sometimes you may think it's just low iron, but then there's different kinds of anemia. Could be iron deficiency, could be vitamin B9. So it is good just to try and take all if you can. Take folic acid, and usually they are not expensive. Take folic acid, take vitamin C to aid the absorption. And I generally like to advise that you should add vitamin B just to get that extra energy. As I've said, that pregnancy, lactation, and heavy flow can be the cause of low iron or anemia. So contraceptives as well, they deplete vitamin B. As I've said, that if you are feeling tired and maybe due to low iron levels, do take vitamin B to help with energy. And now I'm saying contraceptives can also deplete some of your vitamin B, vitamin B9, which is a folic acid, and vitamin B6, because now there is an increased demand or increased requirement of nutrients in your body required to process the synthetic hormone like your estrogen. So to be safe, take it off. Okay, this is quadrifair. I'm making an example. This is Quadrafa. It was a good one. It dissolves in mouth, very palatable. Yes, but I like it because it has vitamin C in it, folic acid, and vitamin B12 and 6. So you don't really need to worry about taking extra vitamin C when you're taking this one. But personally, I find this to be more effective. They're all effective, trust me. This is very mad, but this is just iron 50 milligrams. So I make sure to take folic acid with it, and then I take vitamin C to aid absorption of iron. Remember, I'm not promoting any products. I'm a pharmacist, yes, but and a medical student. But I'm not promoting any brand. I'm just showing you to help you understand what some of the product look like. And then I use this Zinplex vitamin B. As I've said, you need to add vitamin B for the reasons that I've listed, whether you're inconceptive, whether you're feeling tired, in addition to iron supplements. So yeah, I use the Zinplex one because it's cheap. You can use any brand. And I know Medirites, they've got very affordable brands of supplements. Clicks all other pharmacies. Solution for correcting low iron or iron deficiency anemia or any other anemia. We say to supplement your iron, then you take vitamin B, you take vitamin B9, which is your folic acid, you add your vitamin C for absorption. Okay, those are supplements, 3 to 6 months straight, and then you can do and check your full blood count again. Secondly, you need to correct your diets. Eat more of green leafy vegetables and eat fortified cereals. I know Weet-Bix and Nutrific, they've got generous amount of iron. Yeah. And then you need to address the diseases. If you have ulcers, as I've said, gastrointestinal bleeding can cause you to lose blood, or if you have hernia or any gastrointestinal problem. So you need to make sure you avoid taking NSAID if you have ulcers. We'll discuss that some other time as a topic on its own. Try to correct the condition. Maybe avoid taking ibuprofen, avoid taking those brown pain tablets, diclofenac. Yeah. Side effects. No, taking iron supplements come with side effects. Main one being the constipation. Oh my god. And also dark stools. So if you see dark stools, don't be alarmed. If you see dark stools, don't be alarmed. It's the side effect of iron. For main side effect is constipation. So how do you correct constipation? Make sure you eat well. More fiber in your diets, vegetables like broccoli and others. Apples, eat more fruits, popcorn is a healthy snack, legumes, your nuts, your seeds, chia seeds, and many more. And green tea, when I take green tea, I don't struggle with constipation. So all of those things, they help you with digestion. And last resort, or if you can't really wait for maybe taking good food like seeded bread, seeded bread also help. But you can then take Laxin or any other laxative. They're always available just to help you with constipation. I hope this helped, but all in all, we need to take our health seriously. Let go for those checkups, because for me, I remember I've known that I had low iron problem. But for some reasons, I think, when did I buy this? I think somewhere towards the end of last year, like October or September. And then I think I went for about a month without taking the supplement. And because I like running and I like doing my morning run, I like doing my walks. All of a sudden I started feeling dizzy, headache. And because God is so faithful, there was this one lady who came to me at the pharmacy, and all of a sudden she switched to a prophetic mode, telling exactly what was happening to me a day before. I was feeling dizzy, I had a headache. She was like, oh, God is watching over you, and there's angels, etc. Angels, I mean. But then she reminded me about the importance of taking iron, because I think she also had a similar problem. She was admitted. You know how God can use people to remind you about your health. God cares about everything in our life, every area, concerned about every area. God is concerned about every area of our lives. So it was after that moment that I remembered that, oh my God, I haven't been complying. Yeah, so guys, we need to really take care of our health. We need to do our checkups. We need to comply with our medication. Yeah, most medication you have to take after food to protect your stomach. Like iron, you have to make sure you take it after a meal to protect your stomach. I wish you good health and may God bless you. Thank you.